Get her.
I got better taste, come on. So the advantage is that you can do those small cuts.
Wow.
And people are going to hospital 1 to 2 days. That's where we were, about 2 days with that approach. So then, the other thing happened was, a lot of times when you're looking at this and you can't make out what's what. Now we have fluorescent imaging ability, so we can look at things even more precisely. And again, I would love to say it's because I'm a good surgeon. No, I'm not. I have some good engineers who have helped me to use some of these technologies. Then that wasn't enough. So someone said, how about can we, instead of 5 incisions, can we make 1 incision? So again, thanks to Mr. Coleman and folks, they said, okay, Singh, we'll give you another tour. So about 5 years ago, we were, believe it or not, 5th hospital in the whole country to get the single port robot. Which is, instead of 5 incisions, you go through 1 incision and it sticks out like a camera. And all arms is quite futuristic because it pretty much will cut about 1 inch. You can have 3-4 instruments going through and it's all flexible. And some crazy people are now working on this, trying to do, say, for example, even kidney tumor. And I've done it in the lab. You can go get a kidney tumor transvaginally, so you don't have to make any incisions. So no cosmetic, and the healing is much better. But that's right now in development and probably coming to a store near you in the future. And it's called nodes or natural orifices surgery. So without having to make a cut, you can go through stomach, you can go through any opening and do still cancer operations and get people that. So this is a quick video of that single port. Go ahead, play it for us, see if it will go, please. And there you can see through that, and you will see snake-like arms come in through that 1 inch incision. Still learning, man. I'm many years into it, I'm still learning. Alright. So this again showed you through, that's the side incision, and we can go in and that's the robot essentially docked in. And why is that important? Because now most cancer surgery, if you ask me, and I've been in this 17, 18 years, that you are going to take out someone's prostate, take out someone's kidney for cancer or kidney tumor in the kidney string and send them home same day, I'll tell you, you've lost your mind. Now, that's routine for us. Same day home. And why is that important? Especially post-pandemic, it made us realize, even pre-pandemic meaning, there was a high rate of infection when you're in hospital. While you're in hospital, recovery stinks. If you're home, you eat your own food, sleep in your own bed, watch your own TV, healing is better. Family members are there. So overall, that's a huge impact on quality of life and recovery. And hence, technology means success. We can do a lot through an incident that small. This is a patient of mine also who had bladder removed for bladder cancer through a 1.5 inch incision. And remember earlier I showed you that massive incision? Imagine the difference in recovery between that and what the other person had. So again, we investigate, we learn, we teach our future surgeons because I think the impact is huge. So some of the other things in our practice, incontinence-wise, we have one of the only few fellowship-trained people who we have actually entire clinic dedicated to overactive bladder in women and full service for any kind of urinary issues for female urology. Infertility-wise, big deal. A lot of folks are now, having kids later in life, had vasectomy, no more, then they want to restart family. And we have one of only 2 microsurgeons in the entire state. Not here, right? But you can imagine, it's not as common as you think. And now it's the prevalence, at least according to the data we see, is that the need for this is going up. Because younger and younger people are having vasectomies, and then later in life they want to start family. Then stone disease, again, we can take care of pretty much, thanks to Dr. Lang's expertise, we can take care of pretty much any stone through small cuts, get you home same day or next day through minimally invasive operations. We can go in, get not just stone taken care of with endoscopic procedure, but one of our biggest area of expertise is prevention. Anyone that you know with that kidney stones, very few people have one. Most are recurrent customers. And our motto is, anyone can treat it, we can help you prevent it. And Dr. Lang and her team does a marvelous job on that. And again, even some of the bigger stones, you can go in from the back and get them. We got devices, I call it jackhammer and vacuum cleaner, built in one. So breaks it and sucks it out, and you go home same day, if not next day. Some of the most advanced lasers, just last year, the hospital invested in 3 big lasers, each of them to tune of almost $200,000. And that has helped minimize stone surgery, also allowed us to do a whole lot of prostate work in non-cancer arena, where men can treat. Back in the day, guys used to have rotor-rooter, that's what they were known as. And as a former person who worked in a military hospital, every vet came in and said, I want a rotor-rooter. But now we use laser, and again, you go home same day, and discomfort and all that is a lot better. So, huge plus for technology. And this is, just to give you an idea, that's the size we're talking about. Tip of the pencil, that's a laser fiber. It's even smaller than that. And for us to be able to get that and get that, all the stones taken care of, is incredible. So, what overall, I've told you a lot about us, but to sum it up, we are a national leader right here in Chattanooga. And again, everyone says my son is the prettiest or my daughter is the prettiest. But I tell folks, look at the evidence. We have some of the best trained people, and we take care of 100-mile radius. We are urologists, where they can't take care of stuff. We take them every day. We take them from a long distance. We are one of the only few educational sites and training sites for urology from all over the country on terms of robotic, laser surgery, and now Dr. Lang is